Better Health Talk, brought to you by Better Health Foundation. And I'm your favorite host, Miss Becca, and I'm welcoming you today to today's episode of House of Becca Health Talks. So before we begin, I would like to of what it's all about. So Becca Health Foundation is all about giving health talks and health promotion tips to our nursing mothers, our pregnant mothers, and our upcoming mothers. And some of the times we what every other day. So today we'll be having a little on malaria. But before, a lot of us have not been so glued to us for the past few weeks. Now this is what we do. Our Instagram choose with viewers comment. So we decided to Facebook. Now because it's easier to be accessed by people and you can actually watch it later on. And if you have a live video, you can actually see the channel and the link will be dropped in on the page after the video. So today we'll be going to our topic. So what's malaria? We all know what malaria is, but how many of us as pregnant women are able to protect ourselves during this pregnancy period from malaria? I've noticed that a lot of pregnant most of the times, and then they find it difficult to treat themselves, or they are even tablets to take because they don't know which one that will affect the baby in utero or not. So today I'll be bringing to you the definition of malaria, the signs and symptoms a pregnant woman should look out for to know she's having malaria, and when to go to the clinic and consult a doctor for treatment, and the kind of treatment that is available in each trimester. When I mean trimester, during pregnancy we have the first trimester, we have the second trimester, and we have the third trimester, each calculating different months or weeks depending on the cases, on the case as the case may be. So today I will not be going in depth into pregnancy. I will just want to give us a tips of how to take care of ourselves from malaria or prevent malaria in pregnancy in order to reduce maternal mortality and low in women. So I'll be what malaria is. Malaria, we all know, is caused by when someone is being bitten by an infected female Anopheles mosquito, and this infected female Anopheles mosquito, bacterium called Plasmodium falciparum, and then if it bites a person or a pregnant woman, it transmits the Plasmodium falciparum into the woman, thereby causing malaria. So what are the facts we are supposed to know as pregnant ladies? What are the things we are supposed to know? This malaria causes 11% of anemia in pregnancy. You're saying, wow, yes, that's how it is. A lot of us don't know that malaria makes pregnant women have anemia. Why? Because when the malaria is untreated in their body, it tends to drain their blood cells, because it actually works on the blood cell. It breaks down their blood cell faster and makes them to lose red blood cells that are supposed to be more in the body, leading to anemia. We also have increased rate of maternal mortality. What is maternal mortality? That is increased rate of death in pregnant women. There are some pregnant women that even die during pregnancy and are not even able to carry their pregnancy to term because of malaria. There are also cases of low birth weight. That is when the baby is born, the baby is either too low for age or too low for weight. So you will notice the baby is born and the baby is weighing like 1.5 kilogram and you're wondering what's happening. Maybe the woman didn't treat malaria well during pregnancy. There are also cases of intrauterine fetal deaths. That is, some babies die in utero because of complicated cases of malaria. So it causes a lot of pain to the mother, and the mother will be like, oh, my baby has died. It's because of some of the malarias that were not treated well, uncomplicated malaria or complicated malaria that were not treated well during pregnancy that caused them. Some we have other cases of heart risks, other cases of anemia in babies, other cases of congenital malaria in newborns. That is, when the baby are born, you just notice that a 2 days old baby is tested positive for malaria. How does it occur? It's because the mother was having malaria in pregnancy and she didn't treat it well. So that is those are the facts about malaria in pregnancy. So I will be going forward to the signs and symptoms that are associated. Now, before I will go to the signs, I would like to divide malaria in pregnancy into two: complicated malaria and the uncomplicated malaria. Now, in the uncomplicated malaria, the mother is expected to see few signs and few symptoms, such as pain in the muscles, pain in the joints. The person will be having fever, chills, rigor. The person will be having dizziness, weakness of the body. It's just the normal symptoms. Those are the things the mother will notice, a pregnant woman will notice during uncomplicated malaria. But in the complicated malaria, we have severe cases such as anemia. The woman might even be jaundiced because of loss of blood and regular breakdown of red blood cells in the body. And we have other things like fainting. The woman might begin to faint. The woman might have pallor. What I mean by pallor is there is this paleness in the extremities of the woman's body. The woman will go for antenatal, like, why are you so pale? Maybe the woman is having complicated malaria already and it's poorly treated in the body. So those are the complicated signs of complicated malaria. So from there, from the signs and symptoms, I would like to go into the treatment. Most of the time, I like to dwell on the fact that I talk about prevention more than treatment. So before I will go into treatment, I would like to talk about prevention. The only way we can prevent our pregnant mothers from getting malaria is to allow them to sleep in insecticide-treated nets. That is why we always advise them when they come for antenatal visits. We always talk to them, give them health talk. Please and please try to sleep in insecticide-treated nets. We also ask them the living condition of their environment. Where do you stay? What kind of environment do you stay in? If you are living in a round compound, how do you clean it? How often do you make it clean? The drainage in the front of your house, how often is it being cleaned? If you have grasses in front of your house, how often is it being cut off? We ask them this kind of questions so that we will know where to come in and know where to advise them. Because most of the time, a pregnant mother might even contact malaria and she might not know until delivery period, and that might cause fetal death when the baby is born. There are some complicated malaria that when the baby is born, the baby dies instantly. And there are some complicated malaria that when the baby is born, the baby will have the malaria itself. And it's always difficult to treat a newborn baby with artesunate derivatives, because you're wondering, how do you treat a newborn malaria? So it's always advisable, we always advise our mothers, it's better we prevent this than let's talk to them on their environment, their living conditions. They should try to cut off their grasses, try to clean their drainage in front of them. Make sure that their windows are well net. There are nets all over their windows to prevent mosquitoes from entering into the house already. You can use insecticide treated nets to sleep at night so that you can protect yourself and your unborn baby from malaria. So I'll go to the treatment. Now, there are 3 types of treatments because it's depending on the trimester. Like I said earlier, trimester the woman is in the first trimester, which is the 0 to 12 weeks. The first trimester, the woman can actually take sulfadoxine pyrimethamine. It's also known as Fancida, and it's a tablet that is the mother during pregnancy at the first trimester. So when the woman comes into the antenatal visit, and then she's asked, investigations are done and history is taken, she's asked all these questions on how she feels, how her body is, and she pain in the muscles, pain in the joints, fever, diarrhea, she is weak. When she complains of that, we always prescribe Fancida as the anti-malaria tablet used for them. And also in the second trimester, which is from 12 weeks, or should I put it in months, from the 3rd month to the 6th month, all these ACTs derivatives, all these artesunate derivatives, you can give it, prescribe it, because it's safer during that period. Now, Fancida is prescribed in the first trimester because at that early stage, we don't know how the mother's blood can actually cope with the artesunate derivatives and other ACTs that are being used. So it is always safer to be, it's always good to be on the safer side. because we know that fancida cannot cross the placenta barrier at that first trimester stage. So it is always safer to always stay with the safe drug rather than going into a drug that is going to actually affect the baby. Sometimes we also use chloroquine instead of fancida in the first trimester. Use chloroquine instead of fancida in the first trimester. While in the second trimester and the third trimester, you can either use the anti-malaria tablets or the artesunate derivatives, whether in intravenous forms or whether in intramuscular forms or in oral form for the treatment, and it's going to work because at that stage the placenta barrier is very strong enough and cannot be penetrated by just any drug. So that is the treatment for malaria, uncomplicated and complicated malaria in pregnancy at the second and third trimester. And don't forget, like I mentioned, we should always, mothers, let us always be careful or be aware of before that date. You should know if either something is wrong, or let's say maybe you're in your second trimester and you're already having for a labor pain, then you should know that's a false labor pain and it might be something that is triggering it. So if you're not even having any other symptoms and you're just having that labor pain, you should try and consult your doctor. Don't just sit at home and try to self-medicate. A lot of pregnant mothers today self-medicate. I wonder whether they don't like the life of their babies. It's better you go to see your doctor, make a complaint, this is how I feel, so they would ask some questions. How have you been feeling for the past 4 days, for the past 5 days? How many drugs, how many things have you taken, to know what is really happening? So try our possible best to always go for our antenatal visits, please and please. I used to say this every video I post and every, like, try to make your antenatal visits, make it a date with your doctor, and don't miss any of your antenatal visits, because they are there for a purpose. They are there to let us know how you're faring and how you're. So that will be all about malaria in pregnancy today. So next week I will have a very good topic for us, and I like to join in. Please try and drop it on the page so we can treat it. It's confusing to you because my time. Drop it on our Facebook page, Anane Rebecca, or you go to House of Becca Foundation. I will treat them and on live video to also talk about them. So, and if YouTube channel, I will drop the link after this video. Subscribe, thumbs up or a thumbs down. Let us know if we are doing better and the things we need to improve on ourselves. Make a comment, please. Give us a thumbs up, comments, likes, dislikes. We need them. We need the critics. We need you to let us know where we are getting. So please and please do well to subscribe when you go to our YouTube page, download the video and share to your friends. Please share to your friends, because I might not be able to reach to a large number of people right now, but I know a large number of pregnant mothers, they need my topics right now, but I'm not able to reach out to them. But you that have contact with them, you have ability to share to them, please do so, and God will bless. Have a blessed day, and I remain your humble host, Nurse Anane Rebecca, a registered nurse and also the brain behind Becca Health Foundation. Make it a date with us next week.